Welcome once again to SoCo Chat, a podcast where we hear directly from county leaders, discuss the latest news, and talk about all things concerning our beautiful corner of California known as Sonoma County. Welcome, everybody, once again to SoCo Chat. I'm your host, Paul Gullickson, Communications Manager for the County of Sonoma. And today, we're once again featuring a roundtable discussion where members of the county communications team and I'll be talking about some of the latest news concerning the county, some of the recent press releases we put out, stories that are out of SoCo Correspondent, the county's newsletter, as well as stories that have come up in the news media of late. And joining me today are three of our county communications specialists. Matt Brown, our Deputy Communications Manager, Ted Appel, our Communications Specialist, and Karina Garcia, who is our bilingual communications specialist and the host of SoCo Chat Espanol, which is the Spanish version of this podcast. But before we get started, I want to give you our trivia question for this week. Today, we are going to be talking a little bit about housing. So our question is this: what property is known as Santa Rosa's first house? Just the first house. If you know, call us at 565-2242 or email us at publicaffairs@sonoma-county.org. And if you're correct, you'll win your choice of a number of gifts, including one of our SoCo Chat hats, one of our reusable water bottles, and our new limited edition, they're not new anymore, well, some of these are, our SoCo Chat coffee mugs, along with a gift certificate for Pete's Coffee. So don't miss out on that. So with that, let's get started with a roundtable discussion. Matt, I'm going to go to you first. This week, I'm not going to say celebrating because it's not a celebration, but we're remembering we're coming to a key 5-year anniversary. It was 5 years ago that the outbreak of COVID occurred. In fact, it was 5 years ago today, I looked it up, that Sonoma County experienced its first fatality. It was on March 20th, 2020. That involved an elderly man with underlying health complications who was exposed to COVID while on a cruise to Mexico, and that brings back some memories. What do you remember about those early days?
Wow, I can't believe it's been 5 years. It's really so much has changed since then. Obviously, those early days really were marked by a lot of fear, a lot of confusion. There was so much we didn't know. Obviously, this was a novel virus that we'd never seen or studied before, so there was so much information we didn't have. Right. It was still, we were learning it on the fly. And in that information vacuum, that's where misinformation filled that vacuum. Yeah. So obviously that was a big challenge, right? So at first there was this sense of sort of unity, of community, all coming together, all experiencing this pandemic at the same time. But that quickly dissolved into partisanship, and it became fractured and polarized, right, with this misinformation. So that was a challenge for us.
Yeah. And in some ways it continues to be. But that kind of community bonding, you were right. I mean, we experienced that to some degree after the fires in 2017, 2018, 2019, 2020, floods. But then, we went right into COVID, and those were indeed crazy days. And I do remember it was in the midst of all that I was brought in to build our communications team, which was a decision that was made before COVID happened, but it was on this date 5 years ago that Governor Gavin Newsom had the first stay-at-home order, right, statewide, and but it was also during that time when the county wanted to create a centralized communications team. So a lot of you, you and I knew you previously, but a number of the people on our team, we were hiring. The only meetings we had were on Zoom. I didn't meet face-to-face for some time because all our business was from home. We were all working in those days. But we staffed up quickly, and it was a critical, important time because so much, as you said, so much of the information needed to get out about, where to health information about masking, those, where to get N95 masks, where to get tested for COVID. Remember that? That was such a key part.
Right.
We had those early days. It was we had those setting up the clinics, and then it was what's remarkable to me. I think what stands out to me most is how quickly we got those vaccinations, right? And it was sure, everything's shut down in March, but by December, mid-December, December 17th, in fact, the county received its first shipment of vaccines. It was the Pfizer vaccines. And we were experiencing more than 600 new cases a day when those first arrived. And then the December, January, February was so busy as we were pushing out and trying to get those vaccinations clinics set up. Remember that, how crazy that was, and getting out information about where to get tested, of course, and all that. But what's amazing is that by March of 2022, we had doled out more than 1 million doses of COVID vaccine in this county, and more than 80% of Sonoma County's population over the age of 5 were fully vaccinated.
Yeah,
that's really remarkable.
That's a testament to that our communications effort. Obviously, when we said there was a lot of misinformation out there, that was a challenge for us. We had to overcome it. And here, at least in Sonoma County, we did a great job. We did, like you said, over 80% of the county had received their primary dose of COVID vaccine, a life-saving dose.
Mm-hmm.
Our COVID numbers were lower than the state average. Our vaccination rate was the 8th highest in the state. Currently, we've now doled out 1.5 million doses when you include like the bivalent second generation of vaccines that we've had, and 95% of our 65-year-old and older population has receed their dose. So
that's amazing. Yeah,
we did a commendable job of getting that information out there.
Well, I really think the credit goes to our Department of Health Services. Their team was remarkable. The amount, we did not have a centralized health center here in our county. Many counties have their own county hospital. We don't have one. And we started from scratch and setting up these pop-ups and working with community partners and trying to get these clinics set up with our hospitals, with their partnership. But our Department of Health Services did so much in and our epidemiological team getting information out there. Back in those days, we were doing 3-4 live webinars each week with our health officer, Dr. Sundari Mace, getting information out about where we were going with our COVID cases, health information, answering all those questions, and then also really reaching out into our disproportionately impacted communities. Some of our Spanish-speaking communities, they weren't getting the right information, and trying to get that to them, working with our trusted community partners, trying to get that information out. Those were really crazy days, and I just really commend our Department of Health Services and all of them for the job and our community partners for that, because in the end, what's amazing of the 58 counties in this state, I think we were 8th or 9th highest in terms of vaccination rates.
8th, yeah, exactly.
I mean, in the end, when we look back, we still had over 500 people died in this county, but 500 when the cost could have been much higher if we hadn't, if all those people hadn't done their work and getting the information out. It really is remarkable. Across the nation, we had 1.2 million people died from COVID over the course of that time. Since the last 5 years, which is roughly twice the people who died in the Civil War. But at the same time, I think, the number of lives that were saved are in like over 14 million based on how quickly they got that vaccine together. So I'm just reliving all that. I'm throwing out these numbers. I went back and dug them up just because it's all coming back so quickly.
It is. And we got through it. The pandemic is over, right? But COVID is still around. It's
Tell us about that. Where do we stand at this point?
It's in the, what they call the endemic phase, right? It's still with us. Yeah. It's less virulent than before. It's not killing people. It's still getting people sick, though. It's like the flu. It's going to come back in waves year after year. And so people will still need to get vaccinated for COVID. There's still a vaccine out there that is helping save lives and helping make people less sick when they do get it. So it's still recommended to get that vaccine.
Yeah, and I've got my booster shot. I've had all my boosters. I'll throw that out there, and we don't track it as much. People aren't testing as much, so we don't know. But we do track it through our wastewater streams. We can see when there's rises of COVID, but as you said, it's not as threatening. But it's still dangerous to our most disproportionately. I mean, our most vulnerable residents, our seniors, people with underlying health conditions, we know that there's risks there, and we still have some people dying. So
Yeah.
we need to, just as we encourage people to get their flu vaccines, when we have RSV cases out there too. We had recent discussions with our public health officer, Dr. Karen Smith, as well as on our Spanish version, Dr. Gonzalez Mendez, about the latest state, and they're encouraging people to get their vaccinations.
Exactly. We're not setting up large-scale vaccine clinics anymore, but you can still get the COVID vaccine mostly through your primary healthcare provider. That's the main place people should go look for it. If you don't have a primary doctor, you can always get one at a pharmacy. CVS, Rite Aid, any of those pharmacies will offer them. And also at a federally qualified health clinic. Those are also offering COVID vaccines.
And I would say, as we talked about with Dr. Smith just a couple of weeks ago, it's good to hold on to one of those N95 masks. I know we hate them, but when you're traveling, it's not a bad idea. There's still a lot of stuff out there, flu and whatnot. And when you go overseas, people are, especially in Asia and other countries, they're always flying with masks nowadays, and I don't blame them for it.
Yeah, it's true.
Well, Matt, thank you. I appreciate that. I want to switch over to Ted right now, who's the editor of our county newsletter, SoCo Correspondent. Ted, we have another edition coming out today. Tell us what's our lead item this week?
Well, we're going to take a look at efforts to increase the supply of affordable housing here in Sonoma County. It's one of the top goals of the Board of Supervisors. They've outlined it in their 5-year strategic plan. And last week, the board took another significant step toward achieving this goal. Basically, they're trying to lower the cost of building new housing by eliminating millions of dollars in government fees for developers who commit to building affordable housing.
Mm-hmm.
And the key word is affordable. Now, these impact fees, they're also known as mitigation fees, are charged to developers and used to fund county roads and parks. Now, the county is going to waive those fees for housing projects in the unincorporated area for developments that reserve units for moderate income, low income, and very low income buyers
Mm-hmm.
and renters.
Mm-hmm.
Now, this waiver is not available to just any housing project. To qualify, developers must record affordability restrictions into the deeds for the homes, ensuring that new rental units remain affordable for at least 55 years and that ownership units remain affordable for at least 45 years.
So I know the overall objective here is to lower the cost of housing. We all agree housing costs are too much, but is this really going to have an impact on the bottom line? I mean, how much money are we talking about, and how many housing units, how many apartments and homes are we talking about here?
It could be very significant.
Uh-huh.
By the estimates that were presented to the board in January, the decision could eliminate nearly $20 million worth of fees in traffic and parks impact fees,
Okay.
to be specific, over the next 2 years alone.
Mm-hmm.
So at that time, there were 15 eligible projects under development that, if completed, would create more than 1,900 units of affordable housing in Sonoma County.
Okay.
So it is a significant commitment by the county to try to get more affordable housing built here.
Yeah. Well, that could have a definite impact on the bottom line, right? Well, speaking of housing, we have another item in this week's newsletter about residents moving into what's known as Elderberry Commons in Sebastopol. This is a 31-room former hotel on Sebastopol Avenue that the county was able to acquire during COVID with Project Homekey funds. Tell us a little bit more about that.
So at last count, we have more than 2,500 people in Sonoma County who are homeless.
Mm-hmm.
Solving that problem is going to take many different types of housing. One important piece of the solution opened this month at that Sebastopol hotel. It used to be called the Sebastopol Inn.
Uh-huh.
The county bought the property in 2020 during the pandemic, and they used it for transitional housing. Now, this is a type of temporary place for people to live while they search for more permanent homes. Last year, the county transferred the property to Burbank Housing, which is a Santa Rosa nonprofit, and converted it into something that we call permanent supportive housing. This type of housing provides long-term shelter and supportive services to people who are chronically homeless. It helps them build independent living skills while connecting them with healthcare, treatment, and employment services.
Okay. Some wraparound services.
Exactly.
Mm-hmm.
So during the renovation, the hotel rooms were converted to studio apartments and equipped with kitchenettes and other modern amenities. West County Community Services, a Guerneville nonprofit, will provide wraparound services at the property.
Mm-hmm.
So it's much more than a shelter, and it is an important piece of the county's goal of ending homelessness.
Yeah, so it's not just getting them getting a roof over their heads, but making sure they have the services and the support they need to stay in housing, and that they can continue this progress in their lives, right?
That's correct.
So they don't fall into homelessness again.
Correct.
Yeah, it makes sense, and it's part of the overall strategy to end homelessness, as they say. Well, tell us more. What else is in our newsletter this week? Give us a summary of a few items.
Well, how much time you got? There's a ton of information in the newsletter this week.
Pick your 2 or 3 favorite items.
All right,
Okay.
all right. Well, last week, an agent working with U.S. Customs, Immigration and Customs Enforcement walked into the Sonoma County Probation Department in plain clothes and handcuffed an individual in the lobby.
Mm-hmm.
This incident made headlines around the Bay Area. In the newsletter, we've got details of exactly what happened and how the county is responding to uphold the civil rights of every resident,
Mm-hmm.
including immigrants in our community.
Yeah, that was a disturbing story. I know there are a lot of staff who witnessed what happened there. It's very unusual. We believe it was the first case where an ICE agent apprehended somebody within a county building like that, certainly in a public location. And there were a number of people in the public who saw what happened. There were a lot of questions about when, and so you're going to go into some more detail on that in the newsletter.
Exactly.
Okay.
We've also got highlights from a pair of new reports that detail exactly how local government is spending our tax dollars. Now, you've already talked about Measure O. We've got more details on that in this week's newsletter. We've also got a story about the impact of Measure M, the 1/8 cent Parks for All sales tax, which was approved by voters in 2018 to support local parks. Sonoma County Regional Parks gets 2/3 of that money, and the county's 9 cities divvy up the rest based on their size. Combined, that translated into more than $13 million for local parks in the fiscal year that ended last June.
Mm-hmm. That's amazing. Give us some example of where some of this money is going to go to.
Well, if you're out in the parks, you're seeing that money being put to work. County completed the first phase of redevelopment at Maxwell Farms Regional Park.
Yeah.
It added 8 miles of trails at Taylor Mountain Regional Park, one of my favorite places to go. It restored habitat at Shiloh Ranch, Hood Mountain, and Doran Regional Parks. And it built gathering areas at Tole Lake and Foothill Regional Parks.
Oh, cool. So, and you offer a list or where people can find out more information about that in the newsletter, right?
Correct. Yeah, a link to the full report where you can actually get into, I don't want to say excruciating detail, but you can.
No, but people care about parks and they want to know, they want to know what's going on. So that's great.
Yeah. All right. And then one more story.
Yeah. Okay.
Maybe the coolest story is about this well east of Santa Rosa that's being outfitted with new equipment that not only pulls water out of the ground during dry periods, but it also pumps it back into the ground during rainy season. And this has a lot of potential for helping out our county during droughts. It costs a ton of money to build reservoirs, and it can be challenging for the environment as well. But there are these vast underground aquifers that have been depleted during the drought. So if we can pump water back into those when we have lots of it, like over winter, and then save it until we need it, it could be a really great solution. So we've got more on that as well.
Yeah, well, I know that's part of the county's overall plan is to do more of that, replenishing our aquifers. We got it's a great way to store water, right? It's a very natural way, and if we can find a way to do more of that injection of water into our wells and into our aquifers, that's a great plan. So, well, that's great. Well, Ted, I'm going to cut you off there because I know you got more stuff to talk about. But just tell people, how can they sign up for SoCo Correspondent? Our number of subscribers continue to grow, and we love that. So tell people how they can sign up for SoCo Correspondent.
And maybe I'd like to just take a moment and thank people who are reading it.
Yeah,
appreciate that.
We love the comments too, right?
Yes, we love the comments, and we can tell that a lot of you value this information because people who sign up for it, they don't quit. Right. They like getting it.
And they open it.
And they open it. Yeah, it's got a lot of good information. So probably the easiest way to find it is to go to our website or to Google the newsletter. It's called SoCo Correspondent. And the actual link is kind of long and unwieldy. So I recently shortened it using Bitly. You want to hear it?
Sure.
All right. Can I get a drum roll? Or all right. It's bit.ly, they have a dot in there, bit.ly/SoCo newsletter.
Perfect. Simple enough.
bit.ly/SoCo newsletter.
Okay, that's an easy way to remember it. Or just Google it and it'll take you right there.
That's also pretty easy to do as well.
Okay, well, thank you, Ted. And we look forward to reading more about this in today's newsletter. Now I'm going to turn to Karina Garcia, our bilingual communications specialist and host of SoCo Chat Espanol, which is, as you know, this is the Spanish version of this podcast. Thank you, Karina, for being here.
Es un placer.
Beautiful.
It's a pleasure. Thank you.
Hey, listen, you have a really exciting project coming up, and I'd love you to tell our listeners about it. It's called Charla. Tell us more about that.
Absolutely. Charla Comunitaria. As I was, sitting here listening to Matt talk about all the numbers and remembering what it was
COVID.
like 5 years ago. Yes.
Yeah.
So Charla Comunitaria was born out of, in response to what was happening with COVID. And as you mentioned, our monolingual Spanish-speaking community was struggling to obtain that information. Where to get vaccinated. Is it your turn to get vaccinated? Where to get tested? And, isolation versus quarantine and whatnot. So in my previous role as field representative for former Supervisor Susan Gorin, I took the initiative to launch this project, and it's an all-Spanish community conversation. Takes place via Zoom because that was a platform where, that we had available at that time. And it's broadcasted simultaneously on Facebook Live. We have a group of experts, professionals, representatives from different organizations, government agencies, and different organizations. And they're there providing information, right? Initially, it was all related to COVID. As things began to improve, we extended the topics to mental health, pesticide awareness, financial assistance, legal assistance, civic education. We had CEO Cristina Rivera on there a couple of times as well, and many others. One of the huge topics that we had was also in multiple indigenous languages, in Triqui Mixteco, in addition to Spanish, which also helped us reach, further community members.
Right.
And it was successful. It took a pause because I transferred from the former supervisor's office to the communications department. And so it took us a little bit, but I am proud to announce that starting April 17th, Charla is coming back. It will be Thursday, April 17th from 6 to 7 p.m. via Zoom and Facebook Live.
Yeah.
And the following Saturday, we have a summary on Channel 50 Estrella TV.
There are partners in this, right?
They are our partners. And the beautiful thing about this partnership is we understand and recognize that not everyone has access to internet or have a Facebook account or know how to navigate Zoom. Yeah. So the TV program allows you to get the information, right?
Yeah.
In Spanish, of course. The only difference is you can't ask live questions during that program, but at least you heard questions that were asked by community members. And sometimes you had the same question that was asked live.
Yeah.
And that's the other great thing. Community members have the opportunity to ask questions of these panelists, and they answer their questions live on the spot.
Yeah.
So.
Well, it's really exciting. And this is coming back on a trial basis. Whereas Charla before was kind of focused on District 1 a little bit, but now this is really going to be county-wide focus.
Yes.
Very similar format. And now tell us what the first episode is going to be about.
Well, given the climate right now in our county and with the recent incident, and we had already talked about this topic, but that just highlights the importance of the first topic, and that is support and resources for our immigrant community.
Yeah.
We will have a couple of attorneys on there answering questions. A representative from Secure Families Collaborative will be on, and we're still confirming if representatives from Health and Human Services will be also talking about the different services available to our communities, because we've seen a decline. People are obviously afraid to come forward and ask for help, but the help is there and they still can't access. So this is a great way to get your information, get questions answered through a reliable resource, because that's another important thing. There's a lot of misinformation out there, and there are people trying to take advantage of this situation. So tune in, listen to Charla. If you don't speak Spanish, but you know someone who may need, this information, please help us share it.
Yeah, I think that's great. And there is a lot of concern out there. There's a lot of uncertainty. This is a way for people to get their questions asked, get their questions answered. They don't have to give their name. They can, if they just want to ask an expert. But it's a way to partner with our trusted community leaders out there and provide a forum for people to get some answers.
Right. And they can, if they call in through the Zoom app, they can ask verbally. They can also type their question in the chat in Zoom, or if they're watching on Facebook, they can type their question in the comments section. I turn into an octopus that day with like all these tentacles, looking over Facebook, looking over Zoom, and just making sure we gather as many questions as possible in that time frame. And if we don't, we also share a resource page where we provide the information to our panelists, including myself. And the other thing that I haven't mentioned is that we have Juan Barragan as the co-host.
Yes, thank you.
Juan Barragan is a former news anchor of Univision, a former co-worker of mine. We became really good friends when we worked at Azteca TV station. It's an all-Spanish network. And he was glad to support this initiative from the start in October of 2020. And so here we are 5 years later, still going at it.
We've come full circle, and now we're back to talking about COVID again. But,
exactly.
but there's still, we learn a lot about communications. We learned a lot about ways to reach people in ways that are accessible to them. And these kinds of forums are really important. So thank you for taking that on.
Absolutely.
And so remind everybody again, the first episode, April 17th.
April 17th, Thursday, 6 to 7 p.m. We will be pushing out information with the link for folks to connect, or they can watch us on Facebook, on the Sonoma County Facebook page.
Yeah, follow the county Facebook page. That's the best way to stay up to date on those.
And so disclosure, it will be all in Spanish. We hope that our non-Spanish speaking members are not too upset, but there's information in English everywhere. And this is specifically targeted to those that are monolingual speakers.
Well, thank you, Karina.
I did want to say, Paul, when you asked Ted how folks can register for the newsletter, we have upcoming events. We're doing a lot of in-person outreach, hoping to attend at least 6 to 7 events in the coming months, and it's a great opportunity for folks to come visit our booth, win prizes with our prize wheel, collect information from the different departments that will be partnering with us, and sign up for the newsletter.
And we'll be having raffles for some of our and our usual prize wheel and whatnot. Those are fun things. And I think our first event will be Cinco de Mayo.
We may have one smaller one prior, but the big one that everyone is getting ready for is Cinco de Mayo in Roseland. It's on Monday, May 5th. And as we joked in our Spanish SoCo Chat Roundtable, Latinos love to party, so it doesn't matter what day of the week Cinco de Mayo falls on, there's going to be a party. So this is on a Monday, fair warning, but we will be out there. It's from 4 to 9. More details will come, so stay tuned to SoCo Chat.
Well, thank you, Karina. And we, as you say, we will be putting out more information about this, but we just want to let people know that we will be there. Well, thank you very much. Well, that's it for our SoCo Chat Roundtable for today. We want to remind you the best way to sign up to receive the county newsletter is to Google SoCo Correspondent or just Sonoma County Communications, and that first link will appear. It'll take you right to the sign up. You can also find past episodes of SoCo Chat. Just Google SoCo Chat. That's an easy way to find out. And before we sign off, I want to remind you about our trivia question this week. That is, what is the first house in Santa Rosa? Very simple. Where was what is the first house in Santa Rosa? If you know, call us at 707-565-2242 or email us at publicaffairs@sonoma-county.org. And if you're correct, you'll have your chance to win your choice of some of our SoCo Chat paraphernalia, as well as a gift card to Pete's Coffee. Also, if you have comments about this or any other segment or have a suggestion for a future topic for SoCo Chat, please email us at that same address, publicaffairs@sonoma-county.org. We thank you, And we hope you continue to follow SoCo Chat on Spotify, Apple Music, Amazon, and YouTube. We'll see you next time. Thank you, Karina, and thank you, Ted, and thank you, Matt.